Good morning, everyone. Good afternoon, good evening. Hello to all. Very excited to have you joining us here. I think we have people just starting to sign on to another very exciting webinar this morning. For me, early, for some, very late. So thank you all for making time today to join us and to participate in this exciting conversation. Give folks a few minutes to sign on. So good morning, good afternoon. I think we're going to go ahead and get started here today. Thank you for joining us for the Uniting Efforts Financing for Access and Delivery Amid a Global Crisis, Innovative Approaches to Maintain Momentum on Neglected Diseases. So this is an exciting time to be alive. There's a lot of challenges going on in our dynamic world right now. And as we're all aware, we are working very hard to overcome many barriers that have been put in our way that were unexpected. Unfortunately, when we talk about neglected diseases, we've had significant barriers from the beginning. So it's a very interesting time to come back and see how we ensure that the neglected don't get further neglected and left behind as we look at all the challenges that are with us now. So it's a very timely opportunity to have this webinar coming on board. I will be your moderator. My name is Julie Jacobson. I'm the managing partner of a nonprofit called Bridges to Development and have been working with the efforts of NTDs for many years now. And I look forward to working with many of my good colleagues who might be on the call now and many more who I haven't met, and look forward to working with you in the future. So my first responsibility as moderator is to introduce you to our webinar and to explain to you a little bit about what you're seeing on your screen. So first off, we're going to have several speakers with us today and a panel, and we'll be introduced to a piece of work that has been on this subject of financing and resources for neglected diseases. But first, on your screen, you will notice at the bottom of the screen, there's if you scroll down, you'll see several different little icons. One of that says Q&A, and that is questions and answers. And so when we get to the point of having questions and answers for our panelists, that's where you will type in your questions, and we have people monitoring those questions. You can vote for questions if you think the questions are particularly good and you want to be sure that they are answered during the webinar. And those questions will be highlighted to me to then give to the panelists as we move forward. So please put your questions and answers in there. You will also see that there's a button that says chat, and I think several of you are familiar with the chat button, but the chat is where you can provide comments or have other questions that you would like to post on the webinar. So please feel free to use that chat feature and interact with folks. We have almost 350 people that have registered for the conference, so there will be a lot of people's eyes and ears on the chat as well as on the video. So the audio and video function has been disabled for participants, but you will see all of the panelists. And if you have any questions, please put your questions in the Q&A. And we also have people that are on board to try and help if there are any technical difficulties. So you can put that in the chat function, and hopefully you'll get your questions answered. So we really encourage you to participate in this. Ideally, we would have been in the same room together, and unfortunately that's not possible, but we really want to encourage you to ask questions and make this as interactive as possible. This is meant to hopefully be a discussion, and we hope to not only share some information with you, but also to learn from you as the participants and your knowledge, because we have an incredibly diverse set of people who have signed up for the webinar with a vast amount of experience. And so we want to bring that learning and experience into this process as we try to figure out how to not have the neglected diseases falling behind. The webinar will be recorded, so we will be able to post this later for viewing, so that will be available to others where schedules or time zones didn't work out. We will have all the speakers' full bios available on the Uniting Efforts website for you. So if you want to learn more about the speakers or perhaps be in contact with them, you can do that. So with that in mind, I would like to introduce our first speaker, Dr. Mandeep Dhaliwal, who is the UNDP HIV Health and Development and Access and Delivery Partnerships. So over to you, Dr. Mandeep.
Hello, everybody. Greetings, good morning, good afternoon, good evening. Thank you for joining us. And thank you, Julie, for the introduction and for getting us off to a good start. On behalf of the Government of Japan, the GHIT Fund, and UNDP, I'm delighted to welcome you to this first webinar of the Uniting Efforts for Innovation, Access, and Delivery platform. Uniting Efforts is a global platform which was launched in July 2019. It's a partnership between the Government of Japan, UNDP, and the Global Health Innovative Technology Fund, or GHIT. The platform aims to facilitate dialogue by convening multiple stakeholders from across government, funders, innovators, civil society, to identify challenges, explore opportunities, and advance solutions to the market failure along the value chain of health technologies for neglected diseases. Neglected diseases, including tuberculosis, malaria, and a whole range of other NTDs, have often failed to attract the attention of market and funding needed to develop new health technology. And even when there have been therapeutics developed, they have often been unaffordable or inaccessible at the country level, remaining out of reach for the people who need them the most. In order to address such gaps, the three partners have established this platform with the aim of broadening and deepening stakeholder engagement across the innovation, R&D, and access and delivery continuum. It's important to note that Uniting Efforts also contributes to multiple SDG targets, including targets on ending the epidemics of TB, malaria, and NTDs, and achieving universal health coverage and access to essential medicines and vaccines for all. Notwithstanding important progress in this field, such as 500 million fewer people requiring NTD interventions, or over 40 countries and territories eliminating at least one NTD, and reductions in malaria incidence and mortality, challenges remain. And those challenges, as we know, have been exacerbated and deepened in many ways by the COVID-19 pandemic. Moreover, neglected diseases continue to reflect the persistent health inequities, and over 1 billion people continue to bear the burden of NTDs, and many of these people are poor. The ongoing COVID pandemic is having a devastating impact on people, economies, and health systems worldwide. Even as countries strive to protect their populations from COVID-19, it is crucial to maintain other health services and adopt measures to mitigate any reversal in our progress towards the SDGs. Projections indicate that as a result of COVID-19, up to 6.3 million more people will develop TB by 2025, and 1.4 million people will die. A global economic impact could also negatively affect the resources that the public and private sectors might dedicate to neglected diseases and further deprioritize the much needed investments. On a positive note, however, COVID has also shown that it's possible to rapidly mobilize human and financial resources, share scientific information, and mount collaborative efforts for the development of health technologies. And I'm sure our speaker from WHO will also allude to this in her comments. But Uniting Efforts remains focused on neglected diseases to prevent these diseases from being further left behind. COVID-19 has highlighted severe fragilities and inequalities from within and among nations, but also noted the importance of, and underlined really the importance of universal health coverage, the need for resilient systems, and for innovation and access to health technologies. And really, Uniting Efforts at a time of COVID-19 is an opportunity for us to reflect how we build back better, how we improve on these fragilities and inequalities. WHO guidance encourages us to use existing national platforms and mechanisms in the COVID-19 responses. So strategies to improve investments in neglected diseases must build on these and are more necessary than ever before. Today's webinar marks an important milestone as we shared a new knowledge project. Landscape of Funding and Financing Opportunities for Access and Delivery of Health Technologies for Neglected Diseases, authored by Rohit Malpani, and we're delighted that he's going to be here to present the paper to you today. This discussion paper was conceptualized during a multi-stakeholder technical meeting, or a set of technical meetings held on the sidelines of the UNGA in September 2019. The paper aims to contribute to ongoing discussions on financing of the SDGs and responses to neglected diseases. But this is not the only conversation. On June 17th, WHO hosted a webinar where they released their NTD roadmap for 2021 to 2030, along with plans for the development of a global investment case. On June 25th, Uniting to Combat NTDs released a global call for action and reflected on lessons learned since the 2012 London Declaration on NTDs. We hope that this webinar will contribute to and amplify these efforts, including a focus on the necessary investments in health systems to facilitate the access and delivery of health technologies. The paper that Rohit will present covers 4 components: an overview of the existing funding trends, an initial mapping of access and delivery funding needs, opportunities to augment funding and resource mobilization, and proposals to improve the efficiency of investments. Our hope is that funders, innovators, and national partners, especially governments, national programs, and affected communities, will find these resources and dialogues valuable in expanding collaboration and designing strategies to end the epidemics of tuberculosis, malaria, and NTDs. Let me finish by thanking the moderator, the panelists, as well as the over 300 registered participants. We're fortunate to have an outstanding level of expertise in this webinar. You've met our moderator, Dr. Julie Jacobson. I also want to recognize our senior government representatives from several countries where UNDP, WHO, TDR, and PATH work through the Access and Delivery Partnership. And I also want to end by thanking our partners for their wonderful partnership, the GHIT Fund and the Government of Japan. We look forward to our ongoing productive collaborations, and I wish all of you online productive discussions and collaborations during and after the webinar. Thank you very much.
Thank you, Dr. Dhaliwal. We appreciate those opening comments and the perspective. And next, as you heard a reference, is our primary speaker, who's going to be presenting a paper for us. And this paper was done by Mr. Rohit Malpani, who's a consultant with Uniting Efforts for Innovation, Access, and Delivery. He is a consultant based out of Paris. He's a lawyer by training and a former policy director from Médecins Sans Frontières Access Campaign and a special advisor for Oxfam. The discussion paper that he will be presenting for us today is called The Landscape of Funding and Finance Opportunities for Access and Delivery of Health Technologies for Neglected Diseases. So over to you, Mr. Rohit.
Thank you, and I'm just going to start by sharing my screen. So I want to thank everyone for the opportunity, and especially to the Uniting Efforts partners for having had the chance to participate and develop this report and to share the findings today. So as Mandeep was just noting in her prior remarks, this has been identified, resource mobilization, as a key priority for Uniting Efforts, both because it is a bottleneck for expanding access to treatment in low and middle income countries, and because many of the ways in which health financing currently is provided can be deeply inequitable between countries and can often rely upon significant out-of-pocket expenditure by people who are affected by neglected diseases. And this can often be deeply regressive for people living in poverty. Now, this report is especially focused upon public sector interventions, both on the supply and the demand side, and the investments that are needed to improve access and delivery of health technologies. As many of you know, there are many different interventions that emerge from the private sector, which play an important role in expanding access to treatment, but this is very much focused on public sector interventions, except for those private sector interventions which eventually are adopted by the public sector. It's important to note that we are focused on neglected tropical diseases as well as tuberculosis and malaria, recognizing that there are important differences between the list of NTDs and TB and malaria, but all of them together do face certain challenges with access and delivery that merit working on them as a group. And this report was done through a combination of desk research, through interviews, and through a consultation held in February, as well as feedback subsequent to developing the report. Now, much of this report was conceptualized and written prior to COVID-19. So I think in terms of the findings that are being shared today, those have to all be taken in light of the fact that much is changing and will continue to change, which is both a challenge, but as both Julie and Mandeep were noting, an opportunity. And these challenges, of course, are well known to all of us in terms of the impacts that COVID-19 is having on economies and health systems, on the fact that as it relates to neglected diseases, it creates significant barriers with respect to prevention, diagnosis, and treatment. And some of you, or many of you, have seen a report that was issued by the Global Fund last week, which put out in quite stark terms what could occur in terms of addressing the burdens of HIV, TB, and malaria over the next period due to COVID-19. We certainly know that many of these challenges and others are also going to be significant for neglected tropical diseases. Now, this is a value chain that has been drawn up by the Access and Delivery Partnership, and there are others, of course, out there that really are trying to sort of express pictorially what it is that we're talking about in terms of the financing needs. And so this is really from where our health technology is first brought into a country or produced within a country, from regulatory approval all the way through to pharmacovigilance once it has been provided to patients and obtaining the feedback that's needed. And I think it's to recognize that this is a mixture both of policy interventions as well as the specific operational mechanisms that have to be put into practice in order to deliver a new technology. Now, again, prior to COVID-19, these were some of the trends which I suppose could be said more broadly existed with respect to donor assistance. First, just that there has been, at best, sort of leveling off of donor assistance and in some respects, a narrowing and decline of donor assistance for health. But even to the extent that that is occurring, it's important, of course, as many here know, that donor funding still represents a substantial percentage of health budgets for low-income countries and continues to play a specific, let's say, catalytic role for many middle-income countries for these diseases. And there is a difference, as I was noting, between what is provided for TB and malaria and for neglected tropical diseases in terms of what the WHO had laid out as an overall envelope of funding that was required for the last Global Action Plan between 2015 and 2019. The donor contributions probably only reached somewhere between 5 and 10% of what was required. And so, you know, there is still a lot that needs to be done in the coming period to meet some of these demands and needs. Now, with some of the sort of leveling off and even decline or narrowing of donor assistance, there has been a significant increase by endemic countries with respect to these different diseases. And so we have really seen an increase over the last decade. But there are challenges with understanding what the picture is. And I think it's surprising that to the extent that we see a fairly accurate tracking of disease investments in HIV, TB, and malaria, and for example, for research and development into neglected tropical diseases, we do not necessarily have a systematic tracking of endemic country investment into these different neglected tropical diseases. And that creates a challenge both in understanding what is required, either from donors or from governments, and even in terms of ensuring that some of these allocations are spent to where they are intended. Often what at least some of the interviewees have noted is that these allocations that are intended for neglected tropical diseases can be unspent or shifted to other priorities. Now, the London Declaration was important not just in terms of focusing upon neglected tropical diseases, but also in terms of crowding in many other different types of investments to help in the fight. And this is going to continue to be an important contributor towards achieving some of the goals that are being laid out by the WHO and others looking ahead. And in terms of many of these investments, it's important to note that these are done in partnership with both donor governments and with endemic country governments in terms of trying to identify where funding can be put forward and trying to leverage the different investments that are being offered up by some of these stakeholders. And for some organizations, for example, product development partnerships, there has been this movement from not only focusing on research and development in these areas, but often staying engaged on some of these new technologies to ensure that some of the investments needed for access are brought forward. And so what we see increasingly is this marriage in terms of the core functions, whether it's a pharmaceutical company, a product development partnership, or development bank in one area of work, and recognizing the importance of investing in access and delivery to achieve some of the objectives of receiving treatment and getting treatments to people in need. So before talking about some of the opportunities that exist in terms of funding, it's important to first identify what needs remain. Now this is challenging. There are many different diseases, there are many different technologies, and of course many different settings and countries that have to be taken into account. So it's difficult to really isolate the exact needs that are needed on a country by country or technology by technology basis. But we did think it was important to try to draw out a general framework. And so this is sort of an effort to say broadly what it is that we're talking about in terms of needs and gaps. First, in terms of what is really being excluded or left behind. So which diseases, which countries, and which populations are really not being addressed in terms of access and delivery. Secondly, in terms of where there is access and delivery and there is funding that's occurring, what else needs to be done to make sure that we're really reaching everyone in need? And then finally, we know that there's a very robust pipeline thanks to all of the investments being made by public and private partners into developing new technologies. So what can we anticipate in the future going forward? Now, in terms of unaddressed needs, when you look at it from a disease perspective, there are specific neglected tropical diseases that tend to be underfunded or not funded at all. And there is probably a relationship that can be drawn between those that are, those NTDs that are funded through mass drug administration, which tend to be supported, versus those that are not. And from the perspective of a donor, this can often make sense since there is a certain amount of leverage that can be provided through mass drug administration. But it does mean for those programs or those diseases which perhaps do not have that type of support, that some programs may not be getting off the ground. As we were noting with respect to countries, many countries have graduated from donor assistance, and many of these countries still have significant burdens of neglected diseases. And so there is a real challenge in ensuring that these countries can be reached through donor funding or can support the endemic investments that are being made. Now, some countries also benefit from bilateral funding relationships, but these are very specific and often mean that other countries that may merit more investment perhaps are being left behind. And then finally, there are certain populations that tend not to be reached even where there is investment. And this is especially the case, for instance, with mass drug administration, where specific populations, let's say, that are marginalized or tend to be on the move or tend not to sort of access certain delivery points may be excluded entirely from these programs. Now, where there are existing programs, there also tends to be a series of access and delivery needs. There are often challenges with respect to registration, especially as many low and middle income countries often are faced with very difficult choices for what they can invest in terms of trying to register products in a timely fashion. There can often be gaps in terms of trying to identify the amount of demand that is required and matching that to supply and ensuring that procurement can run smoothly. There can often be, as I was noting, distribution methods that can only reach certain populations and may not reach others that otherwise cannot reach these types of distribution methods for certain technologies. And often case funding can be limited by the lack of diagnostics or just simply that the health system does not reach certain populations in need. Now, looking forward, at one of the positive spots is that we do have a lot of new technologies which are emerging from the pipeline. And this is exciting because it does provide real opportunities going forward to really trying to make a significant difference around these neglected diseases. So now the challenge is, how can we take all of these technologies that are emerging and ensuring that they can really be brought to patients in need and really improving patient outcomes looking forward. Now, broadly speaking, these are some of the potential needs that will emerge as these technologies come to market. And in fact, some of these already have and are helping to inform this report. And I think much of the thinking that the other panelists and attendees are already contemplating. First, that we may be starting to move away from mass drug administration approaches or drug donation approaches. And while this could mean that we are perhaps developing more refined models of treatment and delivery, it can create real challenges around how we can ensure that we have a sustainable market for manufacturing, supplying, and introducing these products. So how can we ensure that those companies and manufacturers that are going to bring forward these products to market can at least do so on a not-for-profit basis? And so we have to rethink what are the financing models to ensure that that can be done on a sustainable basis. There are many existing standards of care or treatments that have been used now for decades, and to the extent that these will be replaced with new treatments or new standard of care, mean that much work needs to be done to both build acceptance and interest in communities, build new algorithms to provide these treatments, and find ways of both ensuring that existing treatments can continue to the point where we can then transition to newer standards of care or newer treatments. And this involves a lot of work with people all the way from community health care workers through to ministries of health and ministries of finance that have to ultimately make decisions to adopt these new treatments. And we also have to think going forward that there must be greater integration into the healthcare system, that as we move towards test and treat programs and much more refined models of treatment, how can we not just rely on these sort of large scale mass drug administration programs, but really develop more refined approaches? Now, I wanted to now talk through some of the different opportunities. And again, I want to caveat all of this with the fact that most of this was drawn together prior to the COVID-19 pandemic. Now, one thing to note is that there has been this gradual expansion of disease scope of some major global health funds to include additional neglected diseases. So for example, UNITAID has now introduced a new program for Chagas disease, and the Global Alliance for Vaccines and Immunizations has considered introducing additional vaccines for neglected diseases that have emerged over the last few years. Certainly through some of the interviews and engagement last year, there did seem to be an optimism of additional donors stepping forward to invest in access and delivery. And certainly, again, prior to the COVID-19 pandemic, that BRICS countries were really seen as an important source of both investment into domestic neglected disease programs, but also really playing a leadership role at the international level at the G20 and beyond in terms of building platforms and partnerships to bring forward resources and political will to addressing these disease areas. Now, again, domestic resource mobilization is going to continue to play an increasingly important role going forward, and there is a lot of experience to build upon. There are many different tax programs that have already been implemented in different low and middle income countries, whether on alcohol or, for instance, on mobile phone use, which can then be earmarked and dedicated towards either a general health fund or towards specific health priorities. There are indeed many loan programs that have been used to expand access to treatment in the near term. There are challenges with these loan programs, especially as many countries have reached high levels of indebtedness, and some of those indebtedness levels are being further stressed by the COVID-19 pandemic. But there are also new approaches, for instance, by tapping into the finances and resources of the diaspora that could present a real opportunity for endemic countries. And there has been this move towards catalytic funding, whether through institutions like the Global Financing Facility or through existing global health funds that can help to encourage and build larger domestic country investment. And one very positive approach that the Global Fund has championed has been converting debt, bilateral or multilateral debt, and forgiving that debt in association with the debt holders into commitments to investing in healthcare by disease endemic countries. And certainly this could be expanded outside of the remit of the Global Fund. There is one big change from the London Declaration today has been the emergence of many local philanthropists and corporate contributors that really can play an important role domestically in working through their communities and their value chains and ensuring that we're expanding the amount of funding that can be dedicated towards addressing neglected diseases. Consumer donations have always played an important role. The Global Fund has raised over $500 million through Product Red, and there are different initiatives that are emerging increasingly from different regions. And as many of us know, remittances have always played a larger role in supporting communities in low and middle income countries and governments. And there is work, for example, that's already been done with respect to agricultural development that looks to harness these remittances and bring them forward towards investing in development in developing countries. Now, as I noted, private sector delivery has not been a focus of this consultancy, but there are examples of innovative financing mechanisms such as development impact bonds that have been used to scale up certain types of innovative access and delivery schemes, and then having those brought into the public sector with varying degrees of success. And there are also important investments on the demand side, including from many endemic countries, to expand, for example, access to insurance, whether it's microinsurance or community-based insurance, that can help supplement either national government investments or household investments to pay for needed treatment. And as Mandeep was noting, one of the other areas of examination in this consultancy was to look at efficiencies. So what we can do with the existing investments to make them go further and to make them work better around the world. And some of the important advances that have been made the last few years and that will continue to accelerate and grow, for example, is around regulatory strengthening and collaboration. So we have the important work being done across the African Union with the African Medicines Regulatory Harmonization Initiative, as well as the work by the WHO through the pre-qualification program and the collaborative registration scheme. Pooled procurement has played a very important role, for instance, in tuberculosis and matching supply and demand, providing assurance to manufacturers of a minimum order quantity, and also ensuring for the different countries that require access to the product, often with very low demand or with fragmented demand, that supply will be available when it's needed. And certainly as we're talking about COVID-19 going forward, we have to not just think about what can be done to expand vertical programs, but really in terms of integrating different supply and delivery channels for neglected diseases into an integrated approach. And as we talk about the ways in which we are expanding prevention, infection prevention, treatment, and surveillance for COVID-19, it is important to think about what can be done to build also investments as it relates to different neglected diseases. Now, as we were noting before, COVID-19 does present a number of challenges and opportunities. Certainly one of the challenges is around the growing debt levels in different low and middle income countries. And certainly there is an opportunity cost from the enormous investments that are being made by donor countries and philanthropies towards COVID-19, and to ensure that we are maintaining the momentum for neglected diseases and integrating with neglected diseases. There are also potentially specific problems in the pharmaceutical arena, whether it is ensuring the movement of raw materials to ensure that these can be provided for producing different neglected disease technologies, ensuring that as we have restrictions with addressing the pandemic, that these can actually reach patients in need, and even potentially changing supply lines that ultimately will go towards some of these other requirements for COVID-19. And as an ending point, just to note some of the things that we really have to think about going forward. We have to think about what the actual impact of COVID-19 will be on different neglected diseases and on access and delivery of health technologies. As I was noting, that there is much analysis to be done to look at specific diseases and technologies in countries, and being able to determine exactly what investments are needed going forward so that we can encourage both endemic and donor country investment. That we do need to get better data collection, for instance, on how much funding is being provided on an annual basis by donors and by governments for each neglected tropical disease. That we have to ensure that even as we get more platforms coming forward to try to coordinate and bring forward investments, that we make sure that these work well together. And again, that we are looking at novel sources of funding, whether it's emerging from COVID-19 or, for example, for addressing climate change, in which climate adaptation is increasingly being seen as relevant for neglected diseases, since a warming planet will eventually lead to a higher burden of neglected diseases around the world. Thank you very much, and I will stop there.
Thank you very much, Rohit. That was very interesting. And I think one of the interesting aspects of this, this particular paper and of the Uniting Efforts work is this deliberate engagement and thought and partnership across malaria, TB, and NTDs, and really taking what are the learnings from those other areas and how can those be applied to helping NTDs be more successful. So thank you for bringing that out. I think you've given us a lot to think about. We have a panel to introduce, but before I introduce the panel, I have two things to say. One is, don't forget to post your questions in the Q&A section below. That can go to both Rohit, and then we will also be going and having questions with our panelists. We'll start with some comments from our panelists, but first we're gonna pull up some questions for you. So you'll see a question on your, should see a question popping up on your screen. Please, we have 3 questions, so go in there, give your answer, scroll down, answer all of these questions, and then after the panelists give their comments, we'll come back and look at what you said in your answers to these questions. So as you're filling out these questions, I'm going to introduce the names of our panelists. We will have Mr. Sultani, Dr. Sultani, who's the head of the Division of Vector-Borne and Neglected Tropical Diseases at the Ministry of Health in Kenya. I think Dr. Sultani is well known to many folks here in his innovative approaches to NTDs and his enthusiasm that he brings to the field. We have also Dr. Mwele Malachela, who's the director of the Department of Control of Neglected Tropical Diseases at the World Health Organization, who is also well known to many of you on the call, and her leadership has been so welcome to us across the NTD community, and are thrilled to be working with her and taking us forward to 2030 with the new roadmap. We have Dr. Brian Asare, who's the Senior Technical Advisor for Pharmacy at the Ministry of Health in Ghana. And we're very excited to think about his comments for us today as we look at the challenges of getting all of the interventions we have across the 20 different NTDs out to people. And we have Ms. Toko Puli, who's the Director of Uniting to Combat NTDs. So we'll start with opening comments from Dr. Sultani, and I'm going to ask that the questions go away now, and so that we can move on with our panelists. So over to you, Dr. Sultani.
Thank you very much, Julie. Sorry, there's quite a bit of noise in my background. I don't know why it just started a few minutes ago. But I just want to probably make a few comments with regard to the presentation that we've just had, and probably to say that Rohit has brought out some very important issues that are quite pertinent with regard to programming, and especially within elements around access and delivery of health products and technologies. So I just want to underscore the importance of a functional supply chain management system. I think we've come a long way as control programs for neglected tropical diseases, but we still have quite a bit of a distance to cover. And this is going to be done with the continual improvement of the systems, which, I think quite a bit of insights provided by Rohit, very informative. If we can be able to adapt that, then we can make some good progress. But apart from the supply chain, I think there is also a very big role to be played when it comes to acceptability, because Rohit talked about some exclusion of some population segments. And I think the issue around acceptability actually plays a very big role when we look at it practically. So I think it calls for innovative ways of being able to mainstream issues around the whole package, involving advocacy, communication, social mobilization, including matters around health promotion, behavior change communication, the whole package around social science, so that we can be able to understand how do we mitigate some of these bottlenecks that are coming along with the acceptability issues. But I just want to zero in on the element around availability as a very important factor that drives access. Because we are now seeing a situation where there is a very big level of ownership when it comes to partners, both local and external partners, especially when we look at the global platform that makes it possible for national programs to access interventions through donations, through financial support for distribution. But, you know, we are also aware that it is not just this ownership from the partners that is important. We also need to see improving ownership coming in on the part of governments and also on the part of the individuals who are living in areas that are endemic to the NTDs. So there has to be a lot of interaction so that we can also be able to pay attention in terms of strengthening the ownership from governments and eventually being able to shift, to bring about this paradigm shift in stakeholder ownership so that we can be able to drive this inversion and see much more ownership coming from the affected populations as well as governments. And this is actually going to feed directly into sustainability, which we really require at this point, even as we start seeing countries moving towards the elimination of the neglected tropical diseases. We really need to see a picture where sustainability is being achieved. And so this inversion is going to play a very big role. And we can already see governments getting interested in neglected tropical diseases, but we really want to see much more in terms of the governments. And then finally, I just want to also comment on the issue around, you know, when you look at the disparities, we are talking about health products and technologies here. But even among the health products and technologies for NTDs, we are already seeing a lot of disparities when we consider, for example, the medicines that are available for MDA. And then when we look at other products and technologies like the test kits that we require, the diagnostics that we require to be able to inform on how we are going to implement these interventions, then we see that we have a much longer distance to cover when it comes to the diagnostics. So I think generally, as my opening remarks, that is what I would like to put in there, especially from a program implementation perspective. Thank you very much, Julie. Back to you.
Thank you, Dr. Sultani. Very interesting and important perspectives covering supply chain, ownership, the importance of ownership, and diagnostics, which I think will be a repeated theme as we move forward into our panel and discussion. Next, I would like to invite Dr. Mwele from WHO to give her opening comments from the panel. So Dr. Mwele, over to you.
Thank you very much, Julie. And thank you, Rohit, for the very timely and useful discussion paper. So resource mobilization at both domestic and donor levels were identified in the new roadmap as areas that needed special attention and as potential barriers to attaining the 2030 targets. And now post-COVID, that need is more essential than ever as we start to see the economic impact of COVID-19 globally and the impact it will have on NTDs. And financing has also been identified in the roadmap as an enabler, together with coordination and multi-sectoral action, as well as capacity building and awareness as part of the enablers that will enable us to reach the 2030 targets. The paper discusses the lack of systematic tracking of endemic country investments. And as part of the roadmap companion documents, the sustainability framework, we hope, will be able to give country NTD programs a mechanisms by which they can track and effectively any investment, and to allow for accountability and also further understand the gap. So we hope that the sustainability framework will be a tool that program managers and countries will be able to use to actually track their progress and also track investment. The additional companion document that we envisage is the investment case, which will address main bottlenecks to reaching the 2030 targets at global and regional levels, and will be followed by a country comprehensive, country-led and country-owned investment cases based on their individual gaps. So we appreciate the framework identifying the needs for access and delivery, and it's been said quite a number of times, it's been mentioned by Rohit and Sultani, that some of the NTDs are lagging behind. And these are the ones, mostly the ones that are not focused on by preventive chemotherapy. And these tend to be underfunded or not funded at all. So one of the things that we say that the value of the roadmap, of the roadmap having the 20 diseases is quite transformational in the fact that we will be able to deal with what we're calling the neglected of the neglected, or the orphans of the neglected diseases. So it is clear that the future needs emerging health technologies, and this is a critical area, and as stipulated by both your presentation and the paper. And that is why WHO has set up the Diagnostic Technical Advisory Group, because through the development of the roadmap, it became obvious again that without diagnostics, many NTDs would not reach their 2030 targets, and that the diagnostics had been a chronically underfunded area. So the DTAG, what we were calling the DTAG and its subgroups, will identify program and gap-specific products, which will allow the needed progress. So this will only, however, be achieved by innovative thinking and new partners. So many of the efficiencies which are discussed are ones that we hope the DTAG members and observers can assist with addressing. We also look forward to a discussion on innovative financing from all our partners supporting diagnostics. With this, ideas such as blended financing or social impact investing and others come to mind. So as the important discussion paper lays out, we are only too keenly aware that COVID will impact funding to NTDs as well as across the board. As WHO provides coordination for access and delivery for the current products for the 20 diseases, it's important that this coordination role continues and be supported. The roadmap provides an opportunity again to improve coordination and efficiency of domestic and international efforts between the different platforms. And I hope that we will use this roadmap to come together and align ourselves and maximize our synergies. And this will be critical to not losing the progress of the 10 years, and in fact, progressing towards the 2030 targets. Put simply, failure to collaborate and integrate risks all the gains of the past decades in all fields and not only NTDs. Thank you very much for the opportunity to comment.
Thank you, Mwele. Very important pieces that I hope we'll have some questions come up for you on to elaborate even further when we get into the question and answer. Next, I'd like to invite Dr. Brian Asare to come in from Ministry of Health in Ghana to share with us your thoughts and observations. Brian.
Yes, thank you for having me. And I think it's a great paper and very well presented by Rohit. And I just want to look at the issues at maybe two different levels. The first being the issues around efficiency. And I just want to also highlight that I'll be speaking from the perspective of a lower middle income country in the context of health financing and funding. Now, so the first layer being efficiency. There's already some momentum on funding in a lot of our countries. And how best do we optimize the existing, and how best do we make a case for improved or increased funding in that regard? And I'm happy that the paper actually suggests certain initiatives that are very useful, even in a lower middle income country context, as well as other country contexts, I'm sure. Very useful in terms of trying to improve our funding regimes in our various setups for NTDs. On efficiency, a lot of our NTDs, you realize that in most of our countries, especially in lower middle income, are structured based on programs. And the programs are quite vertical in the sense that, for instance, if a control program needs a surveillance system, it's designed and tailored for that program. So the TB program will have its unique surveillance system, the malaria program will have it, the HIV will have a separate one. In talking to efficiency and using existing resources appropriately, are we able to integrate these systems and actually get a bit more value for money in terms of optimizing the use of the existing? There are discussions even ongoing around how insurance systems would also leverage their strengths to cover neglected tropical disease quite efficiently. And mobilizing internal resources in terms of taxations or whatever mechanisms that are used to fund internal insurance mechanisms could be done. In Ghana, I could cite that there are efficiency mechanisms like the integrated financial mechanisms that are being done. It's to ensure that the process of funding, the implementation or the use of funds is actually optimized in a certain way. Of course, there's a lot of civil society action to improve allocative efficiency in terms of having more funding allocated in terms of even what is government's allocation allocated to critical areas in health, a lot of advocacy in that area. Lastly, one has to, on efficiency, one would also talk about the issues around ensuring that we've actually packaged our, what we pay for in health and what we fund. We've actually engineered it appropriately to ensure that our funds are actually giving us the best value for health. And that is also important. So in Ghana, there's a lot of movement in HTA to try to prioritize and optimize how our investments in funding of health initiatives are done. And there we would actually acknowledge the roles that ADP has played in that, as well as other partners who have actually supported us to try to institutionalize these efficiency mechanisms into the way we have actually spent. So then along the line of efficiency, that is it. There are a number of other measures which can come in as we discuss along. The other bit has to do with the actual funding inflows, basically. And there are moves in Ghana. There's a mention of a diaspora fund, the Sankofa fund that has been launched in Ghana by the finance minister. It's supposed to get a lot of the diasporan partners and even citizens to have a way of they also making their contributions to national agenda development. There are initiatives to actually increase allocations from internal funds. In Ghana, we are trying to redefine the model for aid, and that is moving towards more of partnerships rather than just donations in quotes, as I would put it. And that is also gaining ground, and we are trying to actually leverage those kinds of models to ensure that we are able to have sustainable funding of the things that we do. That goes on, and of course, COVID brings us a lot of lessons as well when it comes to rapid mobilization to respond to public health issues. And I'm sure that those lessons would also inform our movements in going forward. I would pause here and leave the rest for the discussions as it comes along, but purely from a lower middle income perspective. Thank you.
Thank you, Brian. Very, very thoughtful comments. I like the ideas of improving efficiencies, increasing integration, especially across surveillance, and how you get new innovations in and prioritizing amongst those for the country's priorities. Next, our next panelist is Togo, who is the director of the United Combat NTDs Support Center. So Togo, over to you.
Thank you, Julie. Good morning, good afternoon, and good evening. Thank you for joining this afternoon's event. And thank you to the organizing partners that make up the Uniting Efforts Partnership. Rohit, your report was very interesting. It's really timely, and we're really happy to offer our reflections and perspectives on the report that you discussed this afternoon. I think one of the things that we found interesting, speaking very much from the perspective of advocacy work on neglected tropical diseases and the challenges that we face, as clearly pointed out in the report, that when you compare with other diseases, neglected tropical diseases really don't benefit from the level of resources that are available elsewhere. But an interesting perspective that was brought in was about framing of financing for access and delivery, which was proposed in the report, which we completely agree with. And I think if there is one thing that we've learned and which has been aptly demonstrated by COVID-19 is the clear and strong link between healthy populations and economic productivity. Countries in unimaginable ways have been brought down to their knees by a disease. It's incredible. And we couldn't explain to people before how health is important to productivity, how it's important to have healthy populations. And I don't think we'll have similar struggles going forward about why it's important to invest in health. And I think this is an interesting thing that COVID-19 has really highlighted, that health isn't just, financing for health isn't pure consumption, but it's an investment. And I think that framing is really important for us when we're talking about the need for access and delivery, how we explain we are looking for investments that will contribute to economic productivity and prosperity. So that framing, I think, is really essential, and COVID-19 has aptly demonstrated that. The other thing, as an advocate, which you allude to in your report, which I found very interesting, is global solidarity. I just didn't realize how much money there was for health. But suddenly, players that we never even imagined have all come together, and money has been found. There are various explanations and descriptions about why that's possible, including who is affected by these diseases and things like that, given that when we talk about neglected tropical diseases particularly, we are talking about diseases of poverty. And it's the same with TB, it's the same with malaria, about who is affected by these diseases. And suddenly money was found in huge proportions. Just this last weekend, on the 27th of June, the European Union and Global Citizen had an additional replenishment moment, and there 6.9 billion was raised for COVID-19, and this was in addition to what was already raised. So funding is available for health if people believe what it's there for. So there's some big learnings for us, and I was interested in something that the president of South Africa, Cyril Ramaphosa, who is also the chair of the AU, said, and he said, someday when the COVID-19 is behind us, we would like it to be said that we, the nations of the world and people of this world, stood together to defeat the coronavirus. And he said, where there is unity, there is always victory. And I just thought that unity and solidarity is needed for these diseases that have plagued populations for generations. And I guess the big concern for us, obviously, is the fact that a lot of this money has come from overseas development assistance, and it will have a distortive effect on what's available for neglected tropical diseases. It's the same pool of money. And if you look at the list of countries that have given money, it's the usual suspects, the ones that always step up and come up. So we're really concerned about, when everything has been given to COVID-19, what has been left. But hopefully this big argument and this wave of health investment, economic productivity will help us in our advocacy efforts. Also, Rohit, I think you talk about the need for diversified sources of funding. We completely agree with that. And there's some great examples that you mentioned in your report, including domestic earmark taxes that have worked in countries like Philippines and Ghana and elsewhere, and the potential that they could offer for entities. I think our reflection, which you mentioned in your presentation, is that ODA, or Development Assistance for Health, will remain a major proportion of funding, especially in the low-income countries. There are some ideas around the value of loans and some of those things, But I think we know that ministries of finance are always hesitant to take out loans to fund NTDs. So it will depend very much on the context. But I think development assistance will really remain a large proportion, including domestic financing. But one of my key revelations when I went to a WHO Afro-Regional meeting, which involved ministers of finance, was this conversation around efficiencies in health and what that looks like. And I was really stunned by the data that was presented at this meeting, showing just how much countries lose. And we had a conversation with many partners saying, I don't think you heard correctly, because the presentation was that ministers of health in many countries actually return money at the end of the financial year to ministries of finance from under expenditure. And someone said, surely you mean that the Minister of Finance says we're going to give you X amount and they give ministers of health less. And this was completely not the case. So the inefficiencies are huge in the ministries of health. And it broke my heart that the calculations can be as high as 120 million in a single country of financing returned by the Ministry of Health to the Ministry of Finance in unspent funding. So when you talk about procurement and some of the other planning, and I think this is what I like about this conversation, because it's talking about how do we get better in thinking about access at the point when innovations are being developed? How do you think about access and bring that planning at the country level so that it is anticipated, it is expected in order to support the financing? Because money is there, but it's just about how it is spent and who decides it's spent. And I think it really links into the final point which Sultani spoke about, which is around the value of country leadership and ownership. And country leadership and ownership starting from the beneficiaries, the people that are affected by these diseases. As long as the people that are affected by these diseases in these countries are not saying that they need these interventions, we are going to have problems in access and delivery. So we need to do a lot of work in building and working very much at the grassroots and making sure that there is a demand. And then beyond that, looking at what are the structures of local government at state level. To what extent is the Minister of Finance involved? To what extent are the supplementary and complementary ministries involved, and also the heads of state? So at Uniting, we've been working with the African Union to try and really elevate NTDs at the highest levels at the country level. And we're hoping to see that work bear fruit. And we are really excited about the recommendations in your report. They make sense. Underpinning all of them is ownership and leadership at country level. And we look forward to this discussion and hopefully to seeing some of these investments brought to fruition when we next meet in Kigali for hopefully our pledging event on NTDs. So thank you.
Thank you, Togo. Very, very inspiring comments. So before we move into our question and answer, we asked you some questions and we want to share with you the answers to those questions. So the first one, who is the largest funder of diagnostics and treatments for neglected diseases in your health system or country? And we see by far it's government. With 44%, and the second with bilateral donors or non-state actors, and then a third from multilateral donors. So very interesting. And then if we can scroll down on that, we can see the second question. What is the biggest challenge your country faces in funding for access and delivery of health technologies for neglected diseases? And so the first challenge is the inadequate funding across the access and delivery value chain. And I think this will be a big part of what our panel discussion will be about. The second most common answer was supply, distribution, and service delivery. And I think that also brings us into the division there is, or inequity within NTDs between mass drug administration diseases and IDM diseases that require more direct patient care. And the third question, which financing / funding opportunity seems the most promising? And overwhelmingly, the answer to this question is increased domestic financing, which is very interesting, and it makes our panel with our 2 country participants even more exciting to get into how do we do that and how do we help and support that increasing domestic financing. So thank you for those. We have 2 other questions for you. So if we could get those 2 questions posted, and then at the end of the Q&A, we'll bring up the answers to those as well. So can we bring up the next 2 questions, please? So if you could take a moment and take a look at these 2 questions and give us your answers to them, and then we will, at the close of the meeting, go back and see what your answers to these questions were. So they should be up on your screen now. As we get ready to move into the question and answer piece, I would just want to reflect on the paper and the presentation from Rohit, and bring out there were 2 interesting different aspects of this, the presentation. And one was on emerging funding and getting additional resources, and the other was on efficiencies, improving the efficiencies of NTD programs so that they require less resources and can do more with less. And I think those are both very essential elements, and I really appreciate that both of them were covered in the paper. So we'll ask that the questions go away. You've had time to answer those now, and we'll move into our question and answer period. So I'm very interested actually in asking, we have several questions that have been posted, and again at the bottom there's the question and answer section, and you can put your questions down there, and we'll be happy to go to those and get those as part of our question and answer piece. The question that's getting the most interest is focused on diagnostics, and a lot of focus has been on treatment. However, diagnostics remain largely underfunded. Even when these are available, access is a challenge to most countries. And how can this be addressed? And I think this is also when we recognize that the diagnostic gaps that we have in the need for development of new diagnostics, and as the theme of this is how do we get innovations and new things into programs, I'd like to also bring in that aspect. And I'm going to direct that question to first Mwele, and see if you have any comments on how do we ensure that diagnostics are available and that new diagnostics, as they become available, are put into programs quickly.
So Julie, I think I've mentioned it in my comments that diagnostics has been a huge issue for us, and in looking at the roadmap and looking at the gaps of the roadmap, diagnostic really was by far one of the biggest gaps that we saw in moving forward. There were some programs which were literally not going to make any progress at all without getting a new diagnostic. So I think that's something that we have been pushing on and working through the Diagnostic Technical Advisory Group to look across the board at all these diseases and what the needs are, and to have these very important and very functional case use groups to come up with what are the needs in the diagnostic field. Now, the other thing that you talk about, which is really important, it's one thing to try and get the diagnostics, to get R&D in diagnostics and get the diagnostics available. It's one thing to make sure that they get to where they need to get. And so I think the first part is something that we at WHO are trying to address very critically by coming up with all these use cases, and we've got, we thank the people who've supported that. But I think the next stage really needs to be, how do we ensure, like we're doing for supply chain of our medicines, how do we ensure that we also get diagnostics out in the same way? What are the innovative ways that people have been able to get drugs, and we've gotten them to, well beyond the end of the road? How can we do the same for diagnostics? And I think that's a question that we still are grappling with, but I think we're in the right direction.
Excellent. Thank you. Thank you, Willie. And I think, one of the other pieces that Rohit brought up in the presentation and in the paper was the streamlining of the regulatory process too, so that we don't have barriers in the approval process, which I think is another area where efficiencies can be gained. I'm wondering if either Dr. Bryan or Dr. Sultani have any comments on this from the country perspective about getting diagnostics into your country and getting them rapidly into the field. See, Sultani's unmuted there. So Sultani, to you.
Okay, so I think, Julie, this is very important for the programs, because among the very many areas of concern with regard to diagnostics, I can just maybe speak to two of them. The first one being in terms of the demand for diagnostics. Case in point, Kenya is one of the countries that are faced with quite a bit of upsurges in cases of Kala-Azar. And from time to time, you find that the requirement for rapid diagnostic test kits usually increases at some point. And at this point, the big challenge we have is that the diagnostic kits come in very short supply. And before we can even be able to pick out the Kala-Azar cases, they've run out. So it is an issue of availability. But even as we grapple with that, we are also looking at situations where there's been a big improvement, because initially we were having kits which are not very specific, not very sensitive. But now we are seeing that there are newer kits that are coming in which are able to pick out the cases without giving false positives. Now, the other area that I wanted to speak to is around diagnostics that can also help us to monitor programs. For some who are aware, Kenya has come up with a very ambitious program which we are following through, where we want to be able to see how we can break transmission of some of the common entities like the soil-transmitted helminths and schistosomiasis. Now, one of the biggest challenges we are facing is how we can be able to determine that we have actually broken this transmission. And it calls for development of new diagnostics, because if we are relying on cattle cuts to be able to tell us if we have been able to get to a point where there is no more transmission, then it would be a bit difficult. Of course, we will need a more sensitive diagnostic test to be able to inform the program on this new goal that we have come up with. So diagnostics remain a very central part of programming, much as a lot of attention is being paid to the treatments. But in terms of monitoring and in terms of making decisions, diagnostics takes center stage. That's just what I wanted to throw in at this point. Thank you.
Great. Thank you. Brian, did you have a comment?
Yes. So I think the issue of diagnostics is quite critical. It's one aspect where it cuts across from, very advanced engineering pieces all the way to simple rapid diagnostic tools. It comes with a lot of other complexities when it comes to cost of operations and consumables and so on and so forth. So the discussion around diagnostics easily gets complicated. And the way I look at it is that we need to look at it at two levels. How do we introduce a new diagnostic into the flow of things in our service delivery? And how do we actually fund for the consumption of those diagnostics or the use of those diagnostics in the course of work in terms of service delivery? So if we did a good assessment of those diagnostics once they are available, and we are able to certify that the accuracies and the effectiveness, the efficacies in terms of the diagnostic accuracy and so on and so forth are, things that we could pay for in terms of value for money. Once that is established, then we are able to actually bundle the cost of that into the services we provide. When we're able to bundle that cost appropriately, it will mean that the mainstream framework that we are using to fund health services can be extended to cover that. But then if we are not, because, how will you decouple testing of malaria parasites from the treatment of malaria parasites? Of course, I agree with the questioner. Our focus has been on treatment. And sometimes we actually decouple the testing and we pay for treatment and we are not actually paying for the testing. But you realize that that also contributes to the cost of treatment when you look at it at the level of the population. You see, so it's an important discussion. I think that we should start from how we introduce the diagnostics in the first place. A lot of analysis should go into that. And I think HTA has a role to play in prioritizing what diagnostics should be onboarded into our service. Then we can bundle it appropriately into the service package that we have. And that could also be a way where we can leverage existing funding resources to address that.
Thank you. Thank you. We have another question that's been posted that's around creative and innovative financing mechanisms and learning from other programs like Gavi. And I noted also in the paper that the Global Fund is mentioned many times with creative financing ways in which they've leveraged resources. And so I'm going to ask this question to Togo about, ideas about how we can learn from other programs and what they've done in more creative financing opportunities, and maybe if Rohit would like to make an additional comment on what he thinks is maybe the most promising creative financing mechanism when it comes to neglected diseases. So first to you, Togo.
I also read that with interest, and I just replied on the chat here that there are so many places where we can learn. For example, impact bonds that work on reproductive and maternal and child health in India, and also within our own community. I know for eye health, some of our partners have been looking at impact bonds for eye health. So there are definitely opportunities. And I think it would be great for the health economists amongst the NTD community to help us and think about, are those the right things for NTDs? But I think what is exciting and what sets NTDs apart from others are the big wins. So if you're looking at impact, what greater impact can you have than the potential for elimination? So the WHO roadmap has a target for elimination of NTDs in 100 countries. So that sounds to me like a fantastic opportunity if somebody wants to invest in impact, to link the elimination successes in those 100 countries with an impact scheme. But we'll be very much interested from the health economists amongst our community about their views on the potential for some kind of an impact bond for NTDs, learning from some of the other programs, particularly on reproductive and maternal and child health. And I know Ian Jones has been working on an impact bond. I haven't caught up with it lately on eye health, and thinking about how that has worked and if there are any particular lessons for NTDs.
Rohit, thank you. Do you have any thoughts for us from all the work that you did on what might be most promising in some of these innovative financing mechanisms?
I think what comes to mind in the moment is around the debt to health schemes. So those had a lot of success in the early years of the Global Fund, and then for whatever reasons had sort of been done away with, and then have reemerged the last few years. And again, when we were looking at both the historic levels of indebtedness in low and middle income countries, and I think there has been a significant change in sort of the language around either debt forgiveness or reducing debt levels that are unsustainable. I think there's an important message in this also, not only just about some of the impacts of debt, but also it's freeing up financing that then ministries of finance can put forward towards these diseases. And as we're talking about expanding endemic country investments, it's about getting those initial commitments by ministries of finance that is first being freed up through debt forgiveness, that perhaps then can accelerate over time, even when it's not tied to these debt financing mechanisms.
Very interesting. And Brian, I'm going to put you on the spot one more time too, because you mentioned in your comments the diaspora bonds, and that's something that's happening in Ghana. Is that being successful? It sounds like a very creative way of bringing resources back into the country.
Okay, so that is true. It's rather a new initiative that was launched quite recently in Ghana. The facts are that we have about over a million Ghanaians registered on paper, registered in the diaspora. And if you look at the diaspora reinvestment, or the bulk of financial transactions, is to the tune of about $7 billion, and that's per annum. And vis-a-vis a typical national budget of about 10 billion per typical year in some of the previous years, and so on and so forth. That was a very significant move, because per capita, we are talking about $7,000 per capita in terms of the diaspora citizens, So it's a new initiative. It's a catchy name. The Sankofa Fund is also there, as I said, and we are just trying to see how that plays out I can't talk about the quantum of funds that has been raised through that yet, because it was just launched recently. But it is a move that I think, I believe strongly, if we are able to seed appropriately, we are able to actually leverage a lot of these diasporas. It's about how we negotiate and package it in terms of the trade-offs. I mean, why would people want to engage? And if we are able to package it appropriately, I think that it is a good initiative, and that we can actually have that as a huge bundle that supports health. The interesting thing is that it was not defined as a health specific bond, but then it's more towards infrastructure. So then the advocacy must come in for a significant portion of that to come to health, and therefore even to neglected tropical diseases. Thank you.
Great. So in looking at the questions that have been posted, I see that we have a couple of questions and focusing on COVID, and I think we can't get away from this panel without having something related to COVID in our questions. And it really, the question is around COVID safe service delivery, and how do we have the programs work and not increase the need and the budget. And one of the ideas is through integration, and so using 2 program budgets so that you can continue to deliver the services maybe for more than one disease at the same time, which would allow you to do the extra pieces that are needed to be able to do MDA or to reach communities in a COVID safe way. Welly, I think I'm going to direct this question to you and your ideas about doing things in a COVID safe way, and then reach over to some of our...
Julie. And as you know, at WHO, we're now working on the resumption of NTD activities. On April the 1st this year, we had to put out guidance that had to stop all the NTD activities, particularly the ones linked to mass drug administration. And so more recently, we've been now saying, how do we get back? How do we resume these activities? And we are getting examples from some countries who went along and did their risk-benefit analysis and moved on to carry out some of these interventions. So an example that I have is Madagascar, where they did MDA for schistosomiasis and LF, the IDA, in two districts in a very interesting way. So first of all, there was the issue of social distancing. There was safety for the provider, the person who came around with the tablets. And there was the mobile phone component for tracking the treatments and everyone who had gotten the treatment. So you had a recording, you had the ability to reach the person, give them the medication, and also to record. And so these are ideas that are coming out, and that was shown to work very well in Madagascar with very high coverage. And so if we can do that, if we're able to do that, of course, they weren't able to do in a mass kind of setting where people lined up, but they were able to do it house to house and very effectively and very efficiently, and work with immunization and other teams as well to deliver their products in the same way. So it was an issue. The solidarity also helped.
Excellent. Thank you. You mentioned IDA, and so that brings me to a question that I'm going to put to Dr. Soltani, being one of the early adopters of the IDA, the triple drug therapy for lymphatic filariasis. Can you talk a little bit about that experience and getting the resources, and what was that process as we look, and what can we learn from that as we look at the future of getting resources for new innovations in NTDs?
Yeah, thank you very much, Julie. I think the IDA experience is one that was a very interesting experience because having had a little bit of interruptions in our program, there was a need for us to be able to catch up in terms of the elimination of LF. And the IDA came in as the perfect opportunity for Kenya. Yeah, but of course, at the time when we were thinking of adopting IDA, there were a lot of, there were a lot of fears, or ranging all the way from the bill, the kind of burden that we were looking at in terms of number of pills, the fact that it was a new regimen, and of course there are a lot of issues that we were expecting to arise around where has it been used before, so acceptability issues. But regardless of that, I think there was a very informed decision to invest heavily in social mobilization and advocacy at all levels, all the way from government to the community, policy level, implementation level, community level, an investment that paid off very well, because at the end of implementation in our pilot sites, we were surprised that the demand for IDA far much superseded the demand for the usual dual therapy with albendazole and DEC, because there was a very strong advocacy that was conducted. In the first round, we superseded the target 80% by far. In the second round, we actually had to deal with a lot of influx from other areas where there was demand for IDA. And so we were able to demonstrate that with good advocacy, it is possible to now be able to implement more innovative ways, which can drastically shorten the implementation period and get us to our goals much faster. So that now we are just dealing with the sustainability, maintaining the elimination status, as opposed to continuously giving MDA. So I think with regard to our experience, I can confidently say that for those countries which are eligible, IDA is the way to go. Thank you.
Excellent. And I think that brings up the opportunity for us to think about these new innovations and how they can increase the effectiveness and impact of the programs, and that there is a benefit both to communities and to to the costs of our programs, obviously, with that. I'm going to thank all of our panelists. We're running short on time now. Thank you very much for all of your wisdom and experience and ideas and creativity, and for being part of the solution as we look to move into this next phase of the NTD journey and the 2030 roadmap. It's clear that in the future, we're going to need to be more creative. We have a bigger tent. We have more challenges within the NTD tent. We're going to need more collaborations to be able to do that, and more integration, which is going to add some complexity, but also opportunities to learn and grow from other programs. And so I'm very excited to be part of this journey with you all. Some really interesting themes that have come off through today: the idea of the NTD programs contributing to increased productivity and prosperity, the strong theme of country leadership, domestic financing, local resources, and creative ways to get local resources into countries, into programs supporting these neglected spaces. And the in unity, there is victory. I love that from the President of South Africa. Thank you, Togo, for bringing up that comment. So first, just to remind you that there's going to be the webinar will be recorded and available to you, and we will make sure that the chat function is available. And so, coming back to the answers to our questions, how much do you think COVID-19 has or will impact service delivery? Overwhelmingly, most people believe that it will severely to moderately affect the health services in your country. And this will be a challenge that we all have to overcome together, and brings up this idea of working together to overcome all of our health challenges, recognizing that NTDs are not the only challenges that happen in countries, and figuring out ways in which we use the strength of our community networks for NTDs to reach others, I think is a great asset that the NTDs can offer. Which of these areas for further work or analysis would you be most interested in seeing from uniting efforts? And in this, the overwhelming majority think strategies to improve coordination and efficiencies of investments. So they are the challenge to uniting efforts. And with that, thank you very much for your answers to those questions. I'm going to pass it over to Catherine O'Hora from Global Health Innovation Technology, otherwise known as GHIT, which most of us have thought of it in that way. And so over to you, Catherine.
Thanks so much, Julie. I'm Catherine O'Hara. Hi, everyone. Good morning, good evening. I know it's been probably a late night for some of you, so thank you very much for hanging in there. So again, on behalf of Uniting Efforts, so GHIT is one of the three partners of Uniting Efforts for Innovation, Access, and Delivery. And on behalf of Uniting Efforts, I really want to thank you, Julie, as the moderator. You did an excellent job, so thank you very much for that. All the presenters, thank you very much. And panelists, I think the discussions and dialogue were excellent, so thank you for that. And over 175 people, from what I could see, have attended this webinar. So I really also would like to thank the participants and also the questions and the polling and for your participation there as well. So really appreciate all of that. I think it made this webinar a really excellent integrated webinar, if you would. So thanks for that. I'm not going to be able to encompass everything and summarize everything. So let me just highlight a few takeaway notes from my end. And as you know, this seminar, if you look at the title of the seminar, the objective, if you would, it started out with financing for access delivery amid a global crisis. So clearly that was referring to COVID-19. We heard that quite a bit throughout the meeting. And there's some takeaways that I took away for the impact that COVID-19 actually has on NTDs. And the few that I noted, first of all, the COVID impact on the healthcare systems, right? So because of this devastating impact that it has worldwide, COVID-19 has worldwide, we're likely going to see a resurgence, right, of some of the public health problems, such as HIV, TB, malaria, and neglected diseases. So this absolutely is a concern. So that's the first flag that I noted. Second flag that I noted is diversion of financial resources. So, you know, we're seeing funds going into COVID-19. What does that mean? That's great and that's necessary, absolutely understandable. However, the flip side of that coin is the risk of the neglected diseases becoming even more neglected. So that to me was an alarming trend that I also heard throughout today's meeting. And finally, less funding perhaps from the high income countries, right? Because they're, you know, some of the high income countries are the ones dealing with the devastating effect of COVID-19. And they really need to prioritize their own national recovery over international aid. So perhaps, you know, some decrease, if you would, in funding there. So these 3 points that I noted, as I said, you know, is a significant impact, may have a significant impact on NTDs and neglected diseases. The latter half of the title, again, going back to the title of the webinar, was the innovation approaches or innovative approaches to maintain momentum, despite of what I just said, of the neglected diseases. And we talked about the financial landscape, and Rohit gave a presentation on the paper that United Efforts and our partners have kind of come together and created as a knowledge product. And some takeaways there from my end as well. We heard loud and clear on the need of domestic funding as well as local ownership. So that, you know, two themes, if you would, that I heard throughout. I heard both Dr. Asari and Toko both mention, you know, maximizing or the need to maximize what's already accessible or what's already available. We heard many times about the word efficiency. So perhaps the funds are there, we're able to gather the funds, but how do we effectively and efficiently use that for NTDs? And we can't do that without the local government or the local systems, if you would, which also leads to sustainability. So truly, you know, that to me was an important point of note. And I think this knowledge product or guideline, if you would, is a good tool for the local governments or anyone involved to be able to know what's out there, what are the financial, what does the financial landscape look like, what's available, what's out there. So just to know that first off as a baseline, I think is a great start. So I think all of us, Uniting Efforts and our partners, is already providing that first step, if you would, in providing guidelines and a framework, as Dr. Muele mentioned, in terms of really trying to beat this NTDs or neglected diseases. So those are some key takeaways that I heard throughout the financial landscape piece. And I can't agree with what Julie had mentioned just now towards the end. power in numbers, right? We can do this together. We saw this, the entire world basically come together to beat COVID-19, and we're still in the midst of it. But we're seeing the entire world coming together. We can do this, we can beat this if we put our minds to it. So I completely agree with that. And finally, Uniting Efforts is also working on the guidance note to support the development of investment cases for neglected diseases, just similar to what we just heard about in terms of finance and that landscape, financial landscape. A very similar approach of a knowledge product in different areas. And the other area is investment cases, and another area is in R&D. So you would absolutely be able to hear about this. We have a webinar scheduled in August, so please join us. It'll be really, I think, an exciting and useful webinar for everyone. And I really want it to be more an interactive webinar, just like today, because I think we really gathered a lot from this interactive approach. A date will be announced. The date is not set at this point yet, but it will be in August. So I really look forward to seeing all of you again there. And finally, a final thank you from me, as well as the two partners, the government of Japan and UNDP, and on behalf of Uniting Efforts. And again, for those staying up late, thank you very much. And for those staying up early, thank you. And I think that's the end of this webinar. Again, looking forward to seeing all you in August. And thank you again.